good. You can still see it then.
Yeah. So we'll go live right over here.
Hi guys, it's Habib. So here we are Monday night. Thanks for joining us. It's hopefully be interesting. I'll try to keep you awake for about an hour. And towards the end, let's go with the questions and answers because I really like the interaction. And today I want to take you through, in particular, the kind of process of the COVID virus in its minor form, in its infective form, and then the serious form, the SARS, the sudden acute respiratory syndrome. And how apt today Boris Johnson, the UK Prime Minister, was taken to the ICU as a precautionary manner because his symptomology continued for beyond a week. And then for precautionary reasons, he was taken to the hospital for apparently blood testing, whereupon he was a little short of breath. So as a precaution, they took him up to the ICU. Just so that in case there is a sudden change in the respiratory status that he's close to a ventilator. So I'm going to take you through the whole course and show you how vitamin C is involved. But I want to bring to your attention the studies that were started actually in 2003, 2004, when the first SARS came about, COVID-1. We're now dealing with COVID-2, which has about 79% similarity with COVID-1. Now, just before I get started on that, as people are joining in, I want to explain that, it's not by accident that we haven't got a vaccination for the SARS-1 or COVID-1. And it's not by accident that we don't have a treatment, because as you know from the coronavirus, from TV, you'll see that those little proteins that stick out from the virus are very adept at connecting to the membrane of the cells, particularly the lungs, and that's why the virus can then penetrate the cells. Now, the problem with finding a treatment or a vaccination is that the more you try to attack the virus, it's going to manipulate itself, mutate itself, and find a different binding receptor site. So that binding receptor site is going to make it very, very tricky to pinpoint the virus with a vaccination or a treatment, because as soon as you do, probably it's going to mutate. So today's conversation about how to make the body's immune system stronger may be much more fruitful, especially when combined with the study. So the study shows that intravenous high-dose vitamin C has promise in the treatment. So when SARS COVID-1 came about in 2003 and 4, the study started in China, where Akestrom et al. In 2005 found some amazing results from the effect of vitamin C on nitric oxide. So nitric oxide is a vasodilator. It increases blood flow. And when you have a lack of oxygen, the levels of nitric oxide can initially be stimulated, but however, it can't keep up. So what the study showed is that by supporting the lung system with nitric oxide, they're able to reduce the amount of viral replication. That means the number of virus multiplying by 82%. That's in the severe case of SARS. That means you're in the respiratory distress, probably ICU. And in those situations, there was a significant improvement. And so now in the USA hospital systems, namely New York, the major hospital system there are employing a high-dose intravenous vitamin C 4 times a day in combination, I believe, with some of those who are using hydrochloroquine and as well as zithromycin. And the hope is that they are able to reproduce the same impacts that they did from China. So the studies that were done were on monkey kidneys. So the kidneys and the epithelium of those lining was infected with the COVID-1 virus. And as a result, what happened is that, in order to stimulate the production of nitric oxide, which, is related to vitamin C, I'm going to get there. What happened is they stimulated the production of nitric oxide by giving an immunological insult. And as a result, the body produced nitric oxide through an immune-mediated and inducible form of nitric oxide synthetase. Synthase. I have trouble saying synthase. And so what they were able to show by increasing the NOS, they produced more nitric oxide, and as a result, the amount of replication of the virus went down by 80%. So we're going to take that analogy and take it through the whole process of before the virus gets infected into a cell, how people vary in infectivity and who progresses and how to mitigate that, in light of the fact that Boris Johnson is now in the ICU with some respiratory distress, and I'm going to explain the application. Now, this is the time to increase the nitric oxide in the lungs, and one of the ways that we're able to do this is by understanding how vitamin C is involved in the production of nitric oxide. So vitamin C is a redox stabilizer. What that means is that it very easily donates electrons and accepts electrons. It's like a little forager. It is supportive of many systems because of its ability to just be involved in very many things. One of those is a cofactor for the production of nitric oxide. So of the nitric oxide, there are three ways to do it. There's neurological nitric oxide synthase. There's endothelial, which we're going to spend a lot of time. Endothelium means blood vessels, particularly the lung. Any endothelial nitric oxide synthase, that's important to produce nitric oxide. And what I was describing in that study was the inducible, where it's an immunological result or response to nitric oxide production. So where vitamin C comes into is that IV vitamin C activates the coenzyme that's necessary for the nitric oxide production, which is in the form of BH4. It's tetrahydrofolate. I'm sorry, tetrahydrobiopterin, BH4. So in short, if we talk about what's the situation in New York now with the major health system, it's they're called, I think, I forget the name of the hospital. It's the largest New York hospital facility, hospital system, and the idea of the vitamin C, high dose intravenous vitamin C, is that it is an antioxidant, it reduces inflammation, and it supports the endothelium. So there's that connection of the endothelium now. So what we're saying here is that when the virus goes from the early stages to being part of the host, the infected individual, and it goes on for more than a week, and you have some worrying symptoms where the temperature may rise to 103 or 104, where their heart rate may go to above 100, where now they're having respiratory symptoms. That means maybe they can't speak and complete their sentence properly. It's a little bit more labored. They're more conscious of it. This is the time to take it more seriously. And as what happened with Boris Johnson is that he was then taken to the hospital and subsequently transferred to the ICU. So what we need to do for him is improve his ability to stop the inflammation in the lung, because that inflammation damages the blood vessels in the lung called the endothelium. And we know that intravenous vitamin C can protect that endothelium through nitric oxide synthase. And so vitamin C can support the endothelium. The vitamin C also at a later stage, when we describe a cytokine storm, that's when people go into this acute sudden respiratory distress syndrome. That's very sudden. That means that one day they seem to be fairly stable, maybe even improving, and all of a sudden they crash. Crash means they can't breathe. They need support, mechanical ventilation. And those are the people that go into what's called a cytokine storm. A cytokine storm means that it's an autoimmune system, your own immune system, in a cascade that cannot be kind of stopped. And those have a very high mortality. The aim is to stop it from that step forward. But what I say is, why not start even before you're infected? So as I told you, this virus is very adept at getting into the cells. Therefore, what we had estimated, and this is based on information over the last few weeks, is that maybe 60% of the population will be infected. Now, we were trying to slow that down so that the small percentage who end up being serious don't overwhelm the hospital system. So if 60% get infected, of those people, say 80% will be very mild, like you and me. We may not know it. We may get a headache. We may get runny nose. We may sore throat, just not feel tired, and we get over it. of the 20%, there's a range. That 20% will feel the effects of anything like a flu-like symptoms. We'll go over some of those symptoms because that NOS that I was describing that comes out of nerves could explain why some people get a loss of smell, anosmia. And then some of those people have a loss of taste. It's a neurological deficit, and NOS is produced from neurological tissue that's called nitric oxide, and the endothelial nitric oxide, NOS, is in the endothelium, which attacks the lungs. And in fact, there's a great correlation, which I'll talk about next week, about the endothelium, which is inherent in all blood vessels, correct? But of course, the lung is a very vital area because that interface between air sac and the bloods will determine the oxygenation, and that is between life and death, right? But that same endothelium, I'm going to talk next week about why there's a certain propensity for this virus with people with hypertension and blood pressure issues, but really it's an endothelial dysfunction problem. Endothelial dysfunction problem. And that is heralded, or people with nitric oxide problems end up with endothelial dysfunction. And aside from COVID and aside from SARS, the first signs of endothelial dysfunction in men is erectile problems. So 40% of 40-year-olds have erectile problems. 50% of 50-year-olds have erectile dysfunction, and 60% of 60-year-olds have erectile dysfunction. But the operative thing here is that people don't need to measure the nitric oxide level because the strength of the erection will determine their indirect level of nitric oxide. So next week when I talk about blood pressure, I'm going to show the analogy between nitric oxide and endothelial function and blood pressure, the analogies, and a biomarker called ADMA. Asymmetrical dimethyl arginine. It's a combination of these things that will determine, how blood pressure is probably one of the biggest risk factors, or blood vessel health. And so blood vessel health indirectly means comorbidity. So if you have cardiovascular problems, that's a vascular problem, even though we say cardiovascular because it's the blood vessels that are inherently damaged and affected by cardiac problems, whether it's a heart attack, peripheral vascular disease, stroke, doesn't matter, right? And then diabetes, because diabetics have vascular problems, whether it's the eyes or the kidneys or the heart. It's a vascular problem. So what I'm saying is that the common denominator is blood vessel, whether it's cardiovascular disease, diabetes, or hypertension, and of course, cancer is definitely a risk factor. So pre-existing conditions is very, very important. I don't want to skirt it. I just want to say that if you do all the other things that I'm going to explain to protect the lung, protect the production of nitric oxide, support your immune system, not only could you prevent the virus, you could curtail the duration of the virus, and you may prevent the progression of the virus in the same way that that same principle will protect those blood vessels, will protect the blood vessels in all these underlying pre-existing conditions. So I'll try and slow down. I'm trying to bring out a lot of information. So here, I want to say that so Boris Johnson is going down the trail of having had the virus. First, he reported that he's COVID positive. Self-isolation, no problem, no biggie. A week later, he's not better. In fact, he probably felt worse, so they took him to the hospital for testing, whatever that means. Some of the testing may be HSCRP, C-reactive protein, but highly sensitive. That's a marker. Some of the other markers, and I found that out with some of my patients, is leukopenia. That means the white cell count temporarily drops. You'd think it'd go up because it's mounting a response, but the virus has an impact on leukopenia. That means the white cells go down. In some people, the liver enzymes go up. So these are maybe the markers that they were looking for. And then I'm sure the oxygen level was okay at that point, because when oxygen saturation goes below 97, 96, now there's a problem with the air and blood transition. And that only happens when the oxygen dissociation curve reaches this limit. What that means is that supposing you have a low blood count, supposing there's lack of oxygen, your blood has a mechanism to release the oxygen more readily. So you rarely will go below 97% oxygenation. So when people start to go below 97 into 96 and 95, that means that dissociation has been saturated and the body cannot rely on that anymore. That's where people can decompensate very, very quickly. That's why from being admitted to the hospital with testing, Boris had some respiratory problems, which may mean that his oxygen level was starting to drop, or he had some breathing trouble. So if somebody's labored with their breathing and the oxygen level is good, that doesn't mean anything. The fact that the labored means that there's a problem with that oxygen blood interface. So that's why they have to, be ready for that. So what do I mean? When a virus is attaching itself with these protein binding sites, these protein binding receptors, then what we can do is make it difficult for the virus to be active. And one of the things about that study from Zhejiang Hospital in China, which started actually in March of this year, was to try to see how nitric oxide could be influential. What do I mean by that? So when the virus is trying to come in, it comes in more readily when there's a lack of oxygen, called hypoxia. So if you keep your nitric oxide level high, then the blood flow is good. Your oxygen levels will be good at a cellular level. You're not going to wait for the oxygen saturation to go down. That's not sensitive enough, because that's very much a peripheral marking. It's an outward marking. On a cellular level, your nitric oxide is much more molecular and sensitive. It is a driver for the immune system. It is a driver for the detox system. It is a driver for vasodilation. So nitric oxide is actually a gas. It's constantly being produced and used. And I know that people said after the age of 40 it goes down. That may be true, but that's because people have erection problems after the age of 40. That's because people are unhealthy after 40. That's because people have pre-diabetes. They have early hypertension. Those are all warning signs anyway for people who are who want to understand that you don't have to wait for the disease to think you have a problem. But let me give you a piece of a parallel example, that a pre-diabetic has the same risk of a heart attack as a diabetic. So you may say, well, a pre-diabetic is not really diabetic and they've not been diabetic for long, but it doesn't matter because the analogies are the same. So whether you have high blood pressure for many, many years, which obviously brings its own set of problems like stiff blood vessels, which increase the risk of a stroke. But having an unhealthy endothelium where the nitric oxide is low and the erections are bad, that is a window for this virus to come in, as I will explain next week. So if you have enough vitamin C in your body, you're keeping that system of blood flow going through that activation of BH4 and the release of nitric oxide. Nitric oxide can be released from exercise from the endothelium. Nitric oxide with that BH4 is released through the pathways in the liver. So people with MTHFR will have deficits in the ability to produce nitric oxide, so they'll be more susceptible to higher blood pressure. So I'm mixing a few things there, a little bit complicated, but I know there's a lot of educated people out there that know about MTHFR. They understand about the health of the liver. It's really integral in all of these things. So hypothetically, if you had a strong immune system with lots of vitamin C, you'd have the nitric oxide available to defend yourself. Supposing the virus gets in, this is where you've heard about, well, what about hydroxychloroquine? What hydroxychloroquine does is allows the cell to benefit from the influx of zinc. But the first thing is you must have enough levels of zinc in your body to get inside the cell. So one of the things that you need to take home message is, it's all good talking about vitamin C and so forth and IV. I'm going to go over all of those things, but measurement is very, very important, because you don't know where you stand in your levels of vitamin C. If you start off very mediocre, you're going to go down. So in other words, when somebody's sick, their vitamin C level goes down. Animals are able to produce vitamin C. They did sheep studies where during an acute illness, sheep were able to produce 100 times more of vitamin C. Humans have lost the ability to produce vitamin C. So you must know your measurement of vitamin C. If it's already low, it's going to go down lower when you're sick. If it's higher, then of course you'll have more of resistance to the levels going down. And that's one of the other mechanisms why people who are acutely sick with the COVID would benefit from the vitamin C. And I'm going to go over what the benefits are. Should it be IV? Should it be liposomal? Should it be oral? And then talking about zinc, if your levels are low to begin with, then your hydroxychloroquine may not be as effective because there's not that much zinc to go in the cells. What happens is the zinc sort of stops the virus from multiplying as rapidly. So it all depends on levels, and levels of minerals and levels of B vitamins, levels of antioxidants. These don't go up and down overnight. They take weeks to go up. They take weeks to come down. Therefore, you should know the intracellular state, because there are serum ways of level testing. There's nothing wrong with that. But what really matters is from the serum that's in the bloodstream, which will be dependent on what you eat and what vitamins you take, but how much of that goes inside the cells will be an accumulative thing over weeks and months. So in other words, the intracellular is the more accurate way of knowing what's in the cells on a steady state over a longer period of time. So whether we talk about zinc, or we talk about vitamin C, or we talk about quercetin. So quercetin is another one that has a very, very interesting immune modulating. So not only can they stabilize mast cells, so it's good for allergies, but they stabilize the cytokine, so you don't get this cytokine cascade. But again, you taking a few quercetin for 1 week, I don't think is going to make that impact, because based on my knowledge of measurements, that whatever you eat, whatever you supplement, because quercetin is in a lot of food. I looked up what is quercetin. It's in everything. So if you have a good diet, it goes back to a wholesome diet. And the principles, if you remember what I started off, don't damage your sleep, don't put bad food in, eat good food, then supplement, and then use power infusions, which I'm about to go into. So if you are able to, consume the right foods, make sure you build up the levels, supplement where necessary, you want to be able to have that in store. So should you be infected and suppose you get the virus, maybe you're the 80% you hardly even know. However, if you're the 20%, you want to make sure that you get over it in 5 days. You want to make sure that you're not the one with the high fevers and the heart rate that goes up, or the one that's having breathing trouble. And how? The only way is to build up your immune system, because this virus is going to be very tricky. Waiting for the cure, waiting for the vaccine, you're going to wait a long time. What you can do now is start to follow the 5 pillars of health that I described previously. And now we're talking about supplementation. And I started off by giving you the evidence about IV vitamin C, and I'll go back to that in a minute, because now that the virus is in, you want to be able to push that virus out. So we talked about in the past, vitamin D is very, very good. And to support your immune system, vitamin C and omega-3, those are all great. Today, I just want to concentrate on that immune boosting power of vitamin C in relationship to produce the nitric oxide. So nitric oxide gives the blood flow, supports the lungs, so that those people are less likely to progress into respiratory distress, right? So if you've had the virus for over a week, and you're over 60 years old, not a good sign. If you've had the virus for over a week and you have pre-existing conditions like lung disease, heart disease, blood pressure, diabetes, cancer, not a good sign. Again, these are not the final or be-all, end-all or be-all, but these are the things that you need to be. So if you have pre-existing conditions and you have any symptoms, you must consult your doctor to go over it. I'm just giving you information and education just to give you guidelines. And so I expect when my patients say, watch this, and they have symptoms, they should call me, so I will spend time talking about the individual case. I'm just talking about general education based on studies that are out there and extrapolating it, trying to incorporate them so that you can prevent the things. When you get it, you can expel the virus quickly. And that should you get it, you don't want to be the one that the virus lingers around because it's found a footing, right? And the people with the pre-existing conditions, the people with low levels of vitamin C, the people with low levels of vitamin D, the people with low levels of good nutrition. So, people cannot supplement their way out if they have a bad diet. Now's the time to make the changes, get the sleep, because without the sleep, your immune system is compromised. And I went through some of that science. I'll go over it again another day. Don't put the bad food in. They interfere with the neuro stability, and you have poor sleep. Even if you wake up with after 7-8 hours sleep, you may feel unrested, because the neurological system is not to be underestimated, and the quality of the food make a huge impact on your immune system directly and indirectly. So directly means your ability to sleep. Indirectly, it alters the microbes. The microbes are where your immune system is at. So that's why your diet is important. So when you eat whole foods, and so all these nitric oxide that I keep telling you about, you're going to get them from food, right? So if you get citrulline, you will be able to convert that citrulline into nitric oxide by eating watermelon, cantaloupe. You can get citrulline in beets, right? So all wholesome vegetables. The other forms of nitric oxide is through nitrates. So if you have nitrates in your diet, green leafy vegetables like spinach and other things like kale, these have nitrates, and the bacteria in your body, particularly the mouth, convert them to nitrites. And the acid in your stomach allow the release of nitric oxide. So that's a second pathway. I mentioned about the liver, which is complicated, but we'll connect that with the IV vitamin C. The other way to make nitric oxide is clearly exercise. So in the days when we said exercise is good for you, now we know why it's good for you. Because when you release nitric oxide, as you exercise, the blood flow through the blood vessels, it's called a shearing force. That shearing force stimulates the release of nitric oxide. That's probably the most powerful way, but you can't be doing running when you're in the ICU. So the idea is to stay in good shape beforehand. So when you're being isolated and you'd be told to stay 6 feet apart, wear your mask, all good stuff, absolutely. That's, I call that a little passive, which means that you're taking precautionary, absolutely necessary to slow down that curve, not to get that high peak. But I am talking about proactive stuff, which is the sleep, don't put the bad food in, eat the good food, go and exercise. Because I just told you, nitric oxide. Nitric oxide is very much a immune stimulating molecule. So going back to the study, that nitric oxide is now being studied at Massachusetts General Hospital in collaboration with Xinjiang Hospital in China. Clinical trial. It's a randomized clinical trial in relation to the inhalation of nitric oxide gas as part of the treatment for SARS in the COVID-19 patients. So it'll be very interesting, but there are some problems with that, because when you inhale nitric oxide, it's very, very difficult to get exactly the right amount. You could overshoot it and cause methemoglobin. That means you won't be able to utilize your oxygen. And if you underdo it, you're not going to get the impact. That's why it's still better for you to make your own nitric oxide. We call that endogenous, right? So even when you're exercising and you produce that, that's called endogenous. When you have a diet rich in nitrates that your body can convert to nitric, that's called endogenous. When you have different types of nitric oxide synthase in your body, neuronal, endothelial, and inducible, these are endogenous. They're just waiting for you to activate it. So one is exercise. The other one is the diet. And remember the neurological. So your nerves have the ability to create its own nitric oxide to protect it. And maybe during the SARS attack, when it's attacking and depleting not only vitamin C, but the nitric oxide of the nerve, that may be why you lose the smell. That may be why you lose the taste. And for people that end up with SARS, that SARS stands for sudden acute respiratory distress syndrome. It's because it goes into the lung and there's inflammation in the lung, and there's a cytokine storm. That's devastating because that's a high mortality. I think nobody wanted to talk about it. It's about 80% mortality. So 1 or 2 people that make it out of that state, they're being cheered because it's a miracle, because it's the chances you're not going to come out of that. It's good to have a ventilator, good to have a bed, but you really don't want to go down there. You want to kind of prevent it. You want to be the one that has it for a short time. You want to be able to knock it out. You want to recover after a week or 10 days. You do not want to go on for 1 or 2 weeks, because once you're on that ventilator, you're on it for 2 to 3 weeks if you're lucky, because that's how long it takes. So it's not 2 or 3 days and you're over it. So where was I going with this? Where I was going with this is that it's very important to keep your lungs in good shape. Again, nitric oxide, exercise, good diet, good sleep, right? And so that nitric oxide, what they found was from that original SARS, the COVID-1, from 2003 to 2004. In 2004, they started studying how nitric oxide production shortened the duration of the hypoxia in these patients with SARS. It shortened the duration that they were on the ventilators. It reduced the tension, the pressure in the pulmonary arteries. We call that pulmonary hypertension. So when people go into this SARS, the adult respiratory syndrome, their lungs fill up with fluid. So there's a lot of pressure on the pulmonary artery. That's the vein that leads to the lungs. So that we call that pulmonary hypertension. That was reduced by utilizing nitric oxide. So in other words, like in the New York hospitals, when they're treating this severely ill patient, using intravenous vitamin C has been shown to support the lung tissue in reducing inflammation, supporting the endothelium through nitric oxide, really. As I said, there's a huge connection between nitric oxide in just regular run-of-the-mill blood pressure or people who develop blood pressure, and how that virus can come in through not only that weakness, but because blood pressure is connected to what we call the COX ACE1 enzyme, and ACE1 and ACE2 have a parallel balancing act, and I'm going to explain that tomorrow. That's why next week, sorry. Blood pressure is not just the pressure, we're going to go into the science of it, and because that science has that link between how people get infected and how the virus can run its rampant course in some people more than others, particularly people with blood pressure. So here we are, we're talking about nitric oxide and vitamin C. So intravenous vitamin C, because anytime somebody's sick, as I told you, in animals, they're able to produce vitamin C. But in humans, when we're sick, our levels of vitamin C drops. So taking vitamin C is essential. That may be one of the mechanisms why people in the ICU benefit from intravenous high-dose vitamin C, because that's the fastest way to replenish that vitamin C. I've had a lot of experience using high-dose intravenous vitamin C in my clinic for other reasons, but you can be sure it is for that same pathway. So because in general, a lot of people are aging prematurely. In general, people are what do you call it? They are getting these, what we call, pre-diabetes or early hypertension. These are actually disease. This is where the function is going down. And so my job, utilizing my 5 pillars, which is get the right sleep, don't damage it, don't put the bad food in because it really wreaks havoc to your body. Putting in the good foods to support the nutrients that are necessary for all the systems in the body to work. Then to supplement it, like with the zinc and the vitamin D and the vitamin C and the fish oil and so forth. And I spend a lot of time talking about that on other occasions. And then to use powerful infusion like vitamin C. So for the sake of argument, let's reserve this IV vitamin C for sick people. That's fine. But all I want to say is that I've had about 15 years experience using high-dose IV vitamin C, much higher than what they're using in New York, but totally safe. There would be at least one adverse outcome. There is none if you follow the right standard of care and protocols. So here, I'm not telling you to go out and get your IV vitamin C. As we say, talk to your doctor about measuring the vitamin C. Talk to your doctor about measuring zinc. And remember the difference between serum, what's floating in the blood, and intracellular, what takes weeks and months to get into the cells, and which is what will help you fight the virus, because the virus goes inside the cell. And then that applies to measurement of anything and everything I've said, because it's a whole spectrum of B vitamins that are necessary. You can't get away with just high levels of vitamin C and expect that everything else will be just fine. You've got to make sure the B vitamins, the minerals, the amino acids, the antioxidants, they're all in the right order. That's the best way to have optimal health. That's the best way to be resilient and to be able to respond and come out of adversity, not least this. And so measurement is one thing, and then using IV vitamin C is one of the most powerful ways, particularly when you have the virus. And in my case, I would do it as a preventive, but that's my opinion about myself. But I would do that after measurement, after using clinical judgment, and use monitoring. Other forms are liposomal. Some people will poo-poo it. Well, let me tell you something. Liposomals are 100% absorbed because it doesn't make it to the gut. You cannot get what we call a GI flush. When you take a lot of oral powdered vitamin C, which is very absorbable, there is a point where your gut can't absorb it, so you have a GI flush, like diarrhea. For some people, that's beneficial if you have constipation. So I sometimes use it as a side effect for people who have a little trouble going to the bathroom. But so my point would be that liposomal will never give you the GI flush because it doesn't stay in the gut long enough. It gets absorbed and into the lymphatic system, I may argue, because from the gut lining, your lymphatic system is surrounding every bit of that gut, 26 feet long gut. And so that's where I have my opinion that liposomals are better. But again, I measure. So whether I take oral, regular, liposomal, IV is not the way to build up the levels, by the way. It has an impact, as I said, of rapidly getting into the cells to support people when they need it most. It is inherently more important when people are sick. And IV is not the way to build up the levels, certainly not the safe way, because as I told you, that most things build up slowly, so including vitamin C. So if you want high levels of vitamin C or high levels of zinc or high levels of omega or high levels of quercetin, you need to take it on a regular basis to build it up slowly, and then over time you do the measurements to see. It takes about 2 or 3 months, so there's no point measuring levels of intracellular every month because you're just not going to make that change, right? Like hemoglobin A1C. Totally separate, but that test is designed to be tested every 3 months. So if you test it every 2 weeks, you're going to get results which are not going to be meaningful. So let's start asking questions, because I can go on all day long. And next week when I talk about blood pressure, nitric oxide, and vitamin C, I'm going to bring some of this information, and I'm going to go back to maybe talking about the oral supplementation. So very, very important to have it in your diet, but your diet is good because it has cofactors in the food which have many, many other benefits. As I was telling you, the vitamin C will only work by activating a cofactor called BH4 before the nitric oxide gets activated, that nitric oxide synthase. So there's lots of domino impact. That's why eating the real food cannot be substituted. This is not a conversation about substituting supplements with food. So keep that in mind. Okay, some of the questions that are coming through right now. All right. So let's see, can you tell the study that supports IV vitamin C in critically ill patients, most recently the IV vitamin trial? Okay, so first of all, the study started with nitric oxide in 2004 after SARS COVID-1. And so because of this COVID-2 and the fact that this SARS COVID-2 has about 79% similarity with COVID-1, it was a natural progression to take that information to the study which started in March 2nd, 2020 at Zijing, that's Xijing Hospital of China, a clinical trial that collaborated with Mass General Hospital in a randomized clinical trial. And what they're trying to show is that by increasing the amount of nitric oxide, that they would be able to mitigate the multiplication, the replication of the virus. And as far as the IV vitamin C, what they found was that in China, they were starting to use IV vitamin C at the interest was from the first COVID-1, now we're in the COVID-2. That interest has continued so that this IV vitamin C has shown promise. So they're now studying it or applying it in the university I forget now. So it's a New York, it's a largest hospital system. So they're using that in combination. So that's the IV vitamin C. But what I'll tell you also is that vitamin C, even oral, activates what we call angiotensin receptor 1, which, there's a drug called angiotensin converting enzyme blocker. And then the newer versions are called ARBs, angiotensin receptor blockers. So vitamin C has an impact on that, which lowers not only blood pressure, but those angiotensin receptors exist in the lung as well. So that's why I'm going to talk about blood pressure on that occasion. So that's the studies on the things that are going on right now.
Someone asked, is there a blood test that we can take to measure nitric oxide levels?
Yeah, so right now there's directly and indirectly. So the gold standard for nitric oxide is when you cut off the arterial flow to both arms, and then when you have probes on the fingertip which measure the pulse and oxygenation, as you release the cuff, the rapid rise in nitric oxide as sensed by the probes on your fingers will determine your endothelial function indirectly or directly. That's the gold standard for measuring nitric oxide levels. So let me explain that in layman's terms. People with endothelial problems, young men that have erection problems, you can be sure that their nitric oxide levels are lower. If they have probes on their finger and their blood pressure cuffs are raised to cut off the arterial supply, and you release them, they'll take a longer time for the nitric oxide level to come up. Conversely, as I know with myself, because I've measured it, as soon as the cuff is off, my nitric oxide level goes up in a normal period of time. So my chances of having low nitric oxide levels are low. The risks are low. That's the gold standard. So you may say, well, can we not measure it? No, it's a gas. You can't measure it. Now, because I'm a physician and I do a lot of cardiovascular risk assessment, one of the tools is ADMA, asymmetrical dimethyl arginine. That reflects nitric oxide. It's almost like a seesaw. If the ADMA is up, the nitric oxide is down. If the ADMA is down, the nitric oxide is up. So you want a low ADMA. ADMA stands for asymmetrical dimethyl arginine. It's how arginine is methylated. It's very interesting because arginine is part of the nitric oxide cycle. So when arginine is converted to citrulline, nitric oxide is released. So there are multiple ways this nitric oxide works. It's fascinating, very complicated. I don't pretend to be an expert on nitric oxide, but I apply the knowledge that's out there in my day-to-day life, whether it's a vitamin or it's a medication or it's a study. So I don't live by one study. I don't die by one vitamin. I don't die by a test. I collaborate and get the best information of all of these things and apply it to clinical practice to get results.
Get some more questions over there.
Okay, having patients prone when vented has shown improved ventilation. Correct. So that means that when people are in the ICU, they have figured out a few things that improve mortality by almost like 30%. And one of those is lying on the belly, which is not the way I recommend that you sleep, because science has shown for normal people, when you sleep on the back, that's not good because your airway can collapse like people with sleep apnea. But even if you don't have sleep apnea, that's not a good way to sleep. It's better to sleep on one side or the other and not on your stomach, because the stomach will impair the diaphragm's ability to open and close, even impair the chest wall to open and close. But ironically, and I think it's just discovery by accident, when they positioned them in the prone position and they're laying on the stomach, they had a 30% reduction in mortality, which is amazing. So, but that's for people in the ICU. I don't do that work much nowadays at all. How much vitamin C should I take? Can you suggest? Okay, zinc, quercetin, etc. Sure, I'll try and give quick answers to all of those. First of all, you should measure it. As I told you, when you get sick, your levels will plummet. If you start high, then you won't go down as much. If you start low, it's going to plummet more. That's probably the best way to kind of guide people. Oral vitamin C has a short half-life. So that means after an hour or two, it's gone. So it's better to take small amounts more frequently, anywhere from 500 milligrams or 1,000 milligrams. I know you're going to have people say, oh, that's so much more than the recommended RDA, right? Recommended daily. RDA is for people to prevent scurvy. RDA is not optimal levels because the people who quote RDAs are not people who are measuring levels. I measure levels. I don't follow RDA. I measure levels, and as such, I'm recommending 500 to 1,000 milligrams multiple times in the day. I personally have only 2 times in the day that I would like to take it because I have a busy lifestyle. So I'll take my vitamin C in the morning and I'll sometimes take it at night. And because I have a liposomal form, I don't worry about diarrhea. But I'll never take padded vitamin C at night because I take a large amount. I take about 2.5 grams. And you may say, why? Because, of that significant amount will get absorbed. But I'll take it in the daytime where I don't seem to have any GI flush, okay? But for some people, you might not be able to tolerate a large amount at once. So that's why I say 500 milligrams. If you don't have a problem with 500, then go to 1,000 milligrams. But, if you do a 500 to 1,000 milligrams 2 or 3 times a day, you've got a good amount of vitamin C. And that, amongst many things, will support the immune system. Now, zinc is about 30 milligrams a day. And that's for getting the levels up. And I think that if you have good levels of zinc and you're taking 30 milligrams a day, it'll be intracellular and you'll be able to minimize the viral replication. In quercetin is a flavonoid. Flavonoids are in the, that's why nourishing foods are so important. Flavonoids, polyphenols, your berries, just have a diversity of colorful fruits and vegetables. Vegetables more than fruits because fruits have a little bit more fructose in them. And for people who are a little bit older, you might want to be a little bit careful. So get those as supplements wherever you can. Or if you're going to have a lot of fruits, go run afterwards, okay? So as far as quercetin, it has more powerful benefits than just stopping the cells from multiplying because it has immune modulating capabilities. So it regulates the cytokines, right? So that's what quercetin, 200 milligrams is the recommended dose. So if I have somebody sick now, there's a few people that I know who are sick. I'm going to say, take at least 30 milligrams of zinc, if not 40 milligrams or more. This is not the time to be, playing around. And then with quercetin, instead of 200 milligrams, take 200 milligrams twice a day. Again, I wouldn't have waited this long, but now that you're here, take more. and the same with the vitamin C. If you take liposome, it's much more absorbable. You're not going to get the GI flush. You can take that round the clock. So the doses are 500 to 1,000 milligrams. Oral can give you more of a flush. You're more likely to want to spread that out. And so in a given day, 2 to 4 grams. In fact, that number is special. Why did I come up with 2 to 4 grams a day? Because that's powerful enough to reduce inflammation. That's powerful because there is no drug to reduce inflammation like C-reactive protein. There are drugs to lower ESR but for rheumatological problems, but those are called steroids and immune suppressive drugs. This microscopic inflammation, which is as much as you need to know, because this COVID causes C-reactive to go up, causes C-reactive protein like hsCRP to go up, and high-dose vitamin C, 2 to 4 grams, is high enough in many cases. So that's why I came up with that number. And it depends on who needs more, who needs less. Depends on where you started off with. So it's a very good question.
So do we do COVID testing?
Yeah, we do COVID testing. So do you think vitamin C in high doses helps treat patients with COVID? Listen, it's supportive, right? So is good sleep. So is not putting junk food in. It's supportive. I'll take my money with supportive because if I've done all the standard of care, now I can supplement, right? And so now's the time to, well, hopefully you would have measured the levels before, and now's the time to supplement. If you didn't have the luxury of the measurement, now's the time to talk to your healthcare professional and gauge. The other word of gauge is called titration. Titration is when to go up, when to go down. The reason why when the studies that I described about using nitric oxide in a way to protect the lungs, that started with the Chinese hospital, the gas nitric oxide is a very powerful and unpredictable way to protect the lungs. You're better off producing it from inside. That's why it's better to get these levels in a build-up. So now's the time to get started. Now's the time to get started on the immune system and maintain it for the long haul. Because by lowering inflammation, not only will you protect your lungs, you can lower insulin resistance, your sugar will be better. Not only can you lower inflammation and your endothelium will be better, your blood pressure will go down. This is not theoretical. This is what I do in my practice. I can tell you for certainty that build up your levels and all the problems that you think you may have, or people with these pre-diabetes, the early high blood pressure, it'll come down. But again, talk to your healthcare professionals. And in my case, the clients that I have, they would ask me questions. So I would be very specific about giving very specific guidelines. Remember, everything I've said here is educational for your information, so you can ask educated questions to your healthcare expert, and then you and your healthcare expert can come to an understanding of what is right for you. Okay, so will a US ICU be open to administering IV vitamin C? Look, all you have to do is state the case, and I'll give you that name if you follow me. I made a little video. I'm going to put it out there of that hospital system, and it's on my phone, which is right here, so I can give it to you. So as I'm answering questions, I'm going to just quickly look up stuff here. Let's see. ICU and resting. Okay. Well, here, there's people are talking about their fathers are talking about being in the ICU right now. So what you want to be able to do is be able to tell them the hospital system in New York, the largest hospital system, and that's called Northwell Health Facilities on Long Island. It's the largest hospital system, Northwell Health System. And so you just want to quote them that. And as our president says, what do you have to lose? Vitamin C is much, much safer than hydroxychloroquine. Much, much safer. It's not a drug. It's natural. As I said, IV won't give you GI flush, no diarrhea. IV, I've never had a side effect. I've used up to 25,000 milligrams. I've used up to 50,000 milligrams. I myself take it on a regular basis. And so, and again, measurements, talk to you. So in the ICU, what can I say? IV vitamin C. Let me give you another study. Norfolk Sepsis Unit, ICU. I think it's part of the VA. Their sepsis unit had a 30% mortality. That means people who are infected in a severe way, sepsis, bacteremia, infection all over the body. High mortality rate, 30%. What they did was incorporate high-dose vitamin C 4 times a day. See how the magic word 4 times a day? You need it round the clock, particularly when you're sick. I'm not going to do 4 times a day on my patients. I'm not going to do it on myself 4 times a day unless I'm really sick. So what they brought down that mortality rate, and you can Google that, Norfolk Sepsis Unit, Norfolk VA Hospital, from 30% mortality down to 9% mortality. That's a supportive nature. It's not to be used by itself, in combination with other supportive care. So if you got somebody in the ICU, yes, tell them about Northwell Hospital System, Norfolk. It's really supportive care. It's complementary, but it's 4 times a day. So Northwell used very measly doses of 1,500 milligrams. That's IV. So 1,500 IV is far more powerful than 1,500 oral or even liposomal. But as I told you, you can use a lot more than that safely. What's the side effect? There is no side effect. It's an anti-inflammatory. As people will say, well, you're going to pee it out. So be it. It's its impact when it's in the system. There is talk about the way it alters electrons on the cell membrane, so your own immune cells can enter cells and make it, make you recover faster. But as I said, vitamin C IV works on 3 levels. It's an antioxidant effect, anti-inflammatory, and its support on the endothelium. It's this multifaceted approach. It's not one thing. It's not an IV vitamins. It's not an antibacterial. It's not an antiviral. It's none of that. It's part of the innate mechanisms in the body that's already in use. You're just highlighting, you're just optimizing that immune boosting function. Hope that helps. Do you think hydrogen helps with COVID patients? Yeah, I mean, that's what the promise is, that more people are making it out of the ICU when they have supportive care in the ICU. Supportive care really means a ventilator, and supportive care means doing the things to keep the patient alive long enough for you to recover. But those patients are recovering faster when they have supportive care with IV high-dose vitamin C 4 times a day. Anybody live going on? I'll be happy to go live with anybody. I'm taking 1,000 milligrams twice a day. Great start. That's 2,000 milligrams. Great. Wonderful. All you need to do is have some measure. I think I recognize that. Make sure you measure levels, the intracellular levels. That will put you in a better position, because then you know how much more you need, right? You can't go wrong with vitamin C, as I keep saying, because it's anything that's water soluble is easily regulated with your kidney. So don't worry about peeing things out. That's the job of the kidney, to regulate. In fact, blood pressure is regulated by the kidney through the renal artery, through the renin-angiotensin system. And I'm going to talk about that because that's where the ACE receptor comes into it. And that's how COVID comes through the ACE2 receptor. Again, COVID has a lot to do with the endothelium. So the conversation I just had today and the one I'm going to have next week is a continuation of the same things, but I'm going to use hardcore science. Everything I've said is based on things going on right now and things that have gone on for a couple of decades. And now we're getting to it because there's a lot of demand for this information right now. And people like myself, I'm grabbing all this information, giving it to you. Let's see, we're getting close to 10 minutes left. So VA study was not able to be replicated. Please look at the vitamin trial and appreciate the lecture. That's fine. Look, if you want my experience, so I don't have sepsis, but in many cases I boost the immune system, so I won't go into my protocol. So I boost the immune system where in almost 90% of my sinus infection, my bronchitis, even my strep, I don't need an antibiotic. Okay, so if you want to learn more, contact me and I'll tell you how. So it's all about the results. So if I bring down blood pressure without a blood pressure pill, call me and I'll tell you how. If you want to know how I bring down blood sugar without using the standard metformin and so forth, and I know exactly how to use them, but that's my second line. My first line is diet and exercise, but I use science for diet and I use science for exercise, just like I've been explaining. So anybody who has complicated questions, feel free to bring it up live, no problem, or call me and I'll go into it for you. But it's about the results. If I can bring down the blood pressure naturally, if I can bring down the blood sugar naturally, if I can overcome simple infections naturally, well, you can say naturally, but high dose vitamins, call me and I'll tell you. All right. Anybody wanting to go live, we'd love to do that. And here, do you think that vitamin C high dose helps with? Yeah, same question poses. Any more new stuff there? All right, so as we're looking for more questions, I'm going to just reiterate, right? You cannot overlook the basic 5 pillars that I've said. Sleep, because one night of bad sleep just brings your antioxidant level down. You multiply that, people with anxiety disorder, depression, and your antioxidant level goes down. How? I measure it. Low antioxidant levels means your immune system is not as strong. Putting bad food will disrupt the gut microflora, neuroirritating, and a whole host of other complications. We can go into that. Each bad thing has its own special way of causing havoc, from the toxicity to the receptor disruptor. That's what insulin resistance is. It's insulin receptor disruption is insulin resistant. So it can happen at a toxic level. It can happen because the receptors are being impacted. It can happen because you're not putting in the nutrients that support that pathway. Inflammation will knock off and disrupt the insulin receptor. That's what insulin resistance is. It's an immunological phenomenon. It's an inflammatory phenomenon. That's why turning off inflammation, for those people who still have issues with understanding it, it will make your insulin more sensitive, so your sugars will automatically come down. In addition to using your bitter melon and your cinnamon and your all the other, in fact, biotin. There's many host of whole host of chromium, whole host that you can do for that. Looks like there may be some more questions here. No more there live. And we're down to the last 5 minutes. So going back to my 5 pillars: don't damage the sleep, don't put bad food in, eat good food. That means wholesome food that nourishes, not you, nourishes your gut microbes. And then you supplement because high levels of vitamin D, high levels of omega-3, high levels of vitamin C. When I say high, I mean, the word is optimal. It's not high, it's optimal. There's a range. You can be at the bottom end, you can be at the optimal range. Nobody wants you to go super high. No one wants you to go low. And you don't have to guess based on the RDA. You just measure it. You measure intracellular. And when those people who say, my doctor measured my B12 and it was through the roof, they measured serum, because you took the pill one day and you extracted the blood the next day. Of course, it's going to look high. It didn't get inside the cell. You need to measure intracellular. There are many labs out there who have the right technique to do it. That's how you. So again, what I brought up may sound simple, but it's a very, 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 very poignant point. It's to the point. So where was I? Supplementing is in this day and age, when out of 7 days, can I honestly say that I had good 7 nights sleep? Hell no. If I said I had 5 days, I'm lucky. If I'm really honest, it's probably 4, because a good night's sleep will be the best prescription. When I have the best workout is when I've had a good night's sleep. It's not because of my nitric oxide. It's not because of my supplementation. Because good night's sleep takes care of everything. And lack of it. Oh, real life person. Come on, let's go. So we may have a live question here. I heard a voice. Hi there.
Yeah.
Fire away with your question. All right. I'm not getting through there. So we'll just carry on. And dairy, gluten, pectins. We did liver cleanse. Yep, liver cleanse. Remember that BH4, the biopterin, tetrahydrobiopterin, is part of the methylation pathways in the liver. And it's not going to happen just by having a clean liver. In fact, they proved that. Vitamin C is really very supportive of that system. Hello. Go for it. How are you?
I am amazing. How are you doing?
That's great. I like to hear very high energy at 9:57. Wonderful. Keep going. What's your question?
Oh, yeah, of course. All day. That's how you have to keep your vibrations really high in order for you to heal this world and heal yourself, right?
I like it. What's your question?
What's your question? How do you figure out a way, now that we are all going through this pandemic, we are all going to have post-traumatic stress disorder as a collective world. What is your opinion on that, and how do you think can we find a solution for that?
That's a deep question, and I like to think I'm deep, but that's not my field. But I'm going to give you a good answer. I'm going to say stay positive. So if you look at my message of avoiding, keep 6 feet away, washing your hands, and so forth, that's all great. I'm all about proactivity. Be proactive. Have a positive mind. There's enough science to show you that positive mind will allow you to live longer. Positive mind will help you recover faster. So even in this situation where my routine has been disrupted, it affects me because I'm a highly positive person. I feed off energy. When everybody's energy is gone, like nobody's out. The place is dead. So I have to keep myself motivated. And this is one of the ways I like it. I like interacting with people. I like talking, and I just try to do the things that are interesting to me. I keep my exercise going as well, right? So that stay positive, stay proactive, And I think that will be the way to, the other way is routine, right? I think I mentioned that last time. Keep your routine, go to sleep on time, wake up on time. You may not be having your normal routine at work and so forth, but create your routine. That's what I try to do with my kids too. Try to maintain their routine because it's better. All right,
Okay.
thank you for that question, and hope to tune in next Monday.
Thank you very much.
Bye-bye.
Bye.
All right, great question. It's really very important because, as we think about the next question, the brain, as I have gone into, is really half your immune system. Now, I'm generalizing, but that's the point, that you can do all the things with your gut and your diet, and you're stressed out, you're not sleeping enough, you're going to just damage the rest of it, because your brain is connected to the vagus nerve through organs like the liver and CD11 cells that communicate to cytokines in your gut, and then you have inflammation. And conversely, if you activate that cholinergic pathway from your brain down, you reduce inflammation. This was a study on inflammatory bowel disease. So I think there's people who like studies, go look up that study. Do I sound aggressive? I don't mean to be aggressive. I'm a pretty friendly guy.
You hit the hour limit on Instagram.
Okay, so tune in next week. Thank you for joining in. Appreciate it. And stay positive. So it's one